Okay, we're back, and this is Linda, and Linda is a longtime patient of mine, and she looks unbelievable for 20 years old. Just want you to know, and she's been kind enough to allow me to use her as a demonstration so that you have greater clarity of what it is that we're doing. So, as I mentioned a few minutes ago, so for example, we've already created a reflex. Also, when we create a reflex or a point, that point, we'll never try and say, well, you definitively have this in certain points, but it's a reflex that can point to the possibility that it may be present. So for example, we created, now that we're in component of the coronavirus, we've created a reflex that can be indicative that the patient may indeed be exposed to the virus. So let me show you the point. So first of all, as you know, I always want to use a kinesiological right arm muscle test. And you notice she tests real strong. So this is going to be my strong component. This is a yes. So I'm just no, yes, no, yes. Now even before I get there, I'm going to go and I'm going to check and see what her priority angle of the triangle is today. That her being is revealing, says, I'm this today, I'm in the moment, and I want this layer of the onion peeled away. So, as I test her, the first point, Linda, take your hand and touch flat right there. Good. And I'm going to turn you around a minute. So this point that I'm testing relates to the 1% physical side of the triangle. So what we're asking is her priority today on the physical side? And you notice it says, no, it's not. She tests nice and strong. Even to the fact that the patient may be exhibiting physical symptoms. And why would that be? Practice member, because maybe the physical is being manifest by another side of the triangle other than the physical. So now we're going to check the second part. Put your two fingers like this, Linda. So this circuit right there relates to the mind side of the triangle. And the body says, my priority angle is in the mental emotional side, and there's no negative connotation. Now, also what we can do is we can check another circuit here, which would mean that the mind is reacting to something from her past. No, and we can test this point. It says, I'm in reaction to something, and we're a little worried about what's going to be, the future. And that makes sense. And she verifies it. Okay? Also, just to demonstrate, so this is where we always begin. We always want to know where that priority angle is, and then we want to go from there. So we've created, let's check the reflex while we're on coronavirus talk. You don't mind if we do this, right?
Not at all.
So we created a reflex right there. I'm going to turn her. And that's a reflex that, if it weakens, indicates that the individual may have been exposed to the virus. Push up hard. And she tests nice and strong. So I would not think that she is, and I, of course, would ask the patient if they have any symptoms like that. And this one, normally probably like a Boy Scout. Is that the Boy Scout or the girls? That's the Boy Scout, see. That's a reflex for active infection. And she doesn't have that. So then I move on. Now, for example, one of the other things that we do is there's a reflex that tells us if we need to do visceral work or manipulation, that many of you know that we do. And it says, yes, I would like that. And then we would move from there. Also, each of the three sides of the triangle has relationship to certain areas of the spine, and we have reflexes for that. So for example, being in the mental side of the triangle, this is a reflex that would tell us that mechanically there's an imbalance in the skull, in the occipital region here. Just trying to demonstrate to give you a feel of how I move. And it says, I don't have that. Also, this point, put your fingers like this, Linda, bisect your Adam's apple, is a reflex relating to the mind side of a triangle for involvement in the neck region vertebrae. She has that. And she attests to it, see? No way she can hold her arm up like that. And it could affect the lumbar in the last 3 years, which is a reflex like this. All of these points, practice members, we developed ourselves. They're not taken from any other system. And she tests nice and strong. So I know that that's not her priority area. So let's test one other thing, and then we'll go from there. Put your hand like this, like you're blocking the sun. So that's why the work is very individualized, because again, what you need is not necessarily what Linda needs, or the next person. So this is a point that we developed that tells us specifically that that individual patient needs certain nutrients or nutritional support on some level. It's not really showing me that. And that could be food, dietary, homeopathy, a supplement, an herb, or something like that. Because I don't have that. So that's good. Also, the other thing too that we're able to do is evaluate we can just have an individual think of the major stress or worry or concern that is occurring in their life. And if it's affecting them, what we would call in a negative way, it'll make them go weak. So why don't you do that in your mind, Linda? You don't have to tell me what it is. Just think about it in your mind. Hold your arm up. Got it? Mm-hmm. And her arm goes weak. And she would agree with that. So we believe that also the focus of the work today would be to the fact of that by the end of her session, that would be cleared out. I'm just going to create one other thing too in demonstration, and then we'll end the video. Also, when we can be, there's other reflexes too, many of them that we can also evaluate as we're on the subject of infection, viruses, bacteria, and supergerms and things like that. So for example, we have developed a general viral reflex. Just pinch your nose like that, Linda. That's a reflex for a virus in the body, or at least an active virus. And you notice she tests nice and strong. And also we created a reflex like this. Separate your fingers a little bit. Which can be a reflex that can be indicative of a strep-based infection, maybe. Test nice and strong. Put your finger like that, right around your Adam's apple. And this is a reflex that could point to staph infection in the body. Doesn't show. That's right there. This would be a superbug or a supergerm infection. So I'm just trying to demonstrate all the different things that are available to you that we can assess in the process of the system. And there's more and more and more and more and more and more and more. So I just wanted you to be able to understand a little bit more about how specific the work is, and then the means in which we can be so specific and individualized in our ability to fix it and correct it. So, thank you. Thank you, Linda.
Thank you.
So we'll keep the videos going. Please respond back with any questions or comments or concerns, and then we'll keep going. Hang in there. We're all together in this, and we'll speak to you real soon again.